The COVID-19 coronavirus pandemic changed the daily lives for all of us. For disabled people and their families, the impact has been even more significant. And we know that many of the individuals and families that we support have been disproportionately affected by the pandemic. People have felt forgotten and left without vital support, information and communication. Local authorities suspended some of their statutory duties. Day opportunities, community services and respite breaks were stopped, and for many people, services were closed without any warning. Support networks were not accessible or were depleted. Grandparents and extended family were not able to support the families that we worked with. People felt extremely isolated, anxious and abandoned as a result. As a charity providing social care and support to people who are deafblind and those with complex disabilities, Sense had to respond and adapt our support to keep people safe and well throughout the pandemic. In our services, this brought new risks and a whole set of different challenges. We were supporting people experiencing heightened levels of anxiety, distress and confusion about what was happening and the changes that they were experiencing within their familiar routines and familiar places, environments and people. Important family contact had to change as we restricted visits into our accommodation services. The use of personal protective equipment acted as a barrier to communication, interaction and support. It also acted as a barrier to communication for our deaf staff. We observed different types and different forms of behaviour from the people that we support. They were trying to make sense of what was happening to them. We also saw different types of safeguarding concerns, particularly for people who were living in family homes, where they were restricted and confined to their opportunities and limited to being in the home. And of course, this has gone on for so much longer than any of us anticipated. At Sense, we took a whole organisation approach to planning and decision making. Our executive team and our operational management teams met on a daily basis to review the situation. We had to make a number of very difficult decisions, including restricting visitors into our services, changes to the way that we manage staff sickness, and also we cancelled our treasured holidays programme during the summer. We had to respond to new government policy and guidance. This often changed on a daily basis and at very short notice. The situation was moving all of the time. However, the people that we support, our staff and our services, have shown incredible resilience during this time and during some of the most challenging circumstances. Our staff have shown great creativity, flexibility and willingness in order to keep people safe, well, and to minimise disruption, anxiety, and to ensure that the people that we support thrive. Staff have found creative ways to enable people to have contact with family members. We've done lots of garden visits, Zoom calls, we've used social media, we've written letters and postcards just to ensure that that family contact is maintained. Information has been adapted to help people to understand the pandemic and what it means for them, to be able to make choices and to stay in control. We introduced programs of desensitization for the use of face masks and other protective equipment. That was really important to manage people's anxiety and to ensure that people weren't scared and that communication was as open as it possibly could be. Our staff developed social stories and visual supports to help people understand what they would experience, such as if they were having to have a COVID-19 test, or when they were going into new environments or familiar environments, but when things would have changed. Our staff changed their working patterns so that they minimised the number of contacts and handovers during the day in order to reduce and minimise the risk of infection. As such, we did not see widespread outbreaks across any of our services. And where there were incidents of infection, risk was contained quickly. The risk of infection was managed and contained very quickly based on that very decisive action that the staff teams took. We were able to maintain our emphasis on promoting well-being for the people that we support. We implemented a virtual timetable of online and accessible arts and sports resources. We saw Keep Fit sessions in people's gardens, and we saw virtual discos and quizzes where people who may not be able to be in the same environment as others, but were able to engage in fun and stimulating activities. We moved our support for children, young people and families online. This enabled us to develop new opportunities and groups for young people and for parents. Families who had previously been unable to travel long distances to some of the centres and some of our events were now able to access our activities, and we saw a real increase in the levels of engagement of people as a result of this breaking down geographical barriers. We sent out 4G enabled iPads to tackle digital inclusion and to enable people to engage. We also provided sensory toys and digital activities. The feedback on these sessions was excellent, particularly for those families that felt otherwise abandoned by our services. We did see some resistance and some reluctance from some families, just thinking that virtual activities wouldn't be for them. But with some encouragement and with some support, those families really benefited from accessing the opportunities that we made available. We also were lucky enough to receive government funding to support our opportunities to enable people to connect and to tackle loneliness and isolation. As such, we launched a national virtual buddies befriending service where we matched volunteers with young people and adults based on mutual hobbies and interests. We distributed buddy bags of resources, arts and sports materials, and well-being products. All of these things help people to connect, to feel less isolated, and to really focus on their own well-being. We saw a significant uptake in volunteer recruitment during this time. We also saw the recruitment of highly skilled volunteers with really advanced sign language skills and communication skills, all wanting to get involved, to offer their support and to engage in these opportunities. We saw great collaboration between our operational teams with our policy team to campaign and to influence national policy on a whole range of different topics, including mental capacity, testing, and the use of personal protective equipment. This had some really positive results, and we were able to campaign government on testing and introducing the use of clear masks in order to support and to facilitate better communication. We were able to develop new offers of support to young carers and to siblings through virtual groups and to one-to-one support. The take-up of our support for young carers and siblings was really positive. These young carers were really struggling in having time to themselves, being able to meet other young people and to share ideas, frustrations, and problems that they were experiencing. And as a result, we've had to increase the frequency of our young carers groups and sessions because the feedback has just been so positive and so beneficial for those young people. The impact of this support has been overwhelming, with many families describing it as a lifeline, and being able to connect with other parents, to offer peer support, to share ideas and frustrations, or just being able to take a 10-minute break. We heard a really powerful story from one parent who was, as a result of her daughter accessing a virtual buddy service, was able to just go and wash her hair, have 10 minutes to herself, and really just recharge. It really supported her resilience and her coping strategies. This has been an incredibly pressurized and challenging few months for us all. It's been frequently uncharted territory and has required an immediate and decisive response. And it looks like it's not going to change anytime soon. We're anticipating that Christmas could be a really challenging time for the people that we support, both in terms of changes to familiar routines, restrictions on being able to go home, and the really important routines and traditions that are so important to help the people that we support just make sense of the world and feel a sense of well-being. However, the stories that we've heard and the creativity, the willingness and the commitment that everyone has shown throughout this period has been both overwhelming and inspiring. It's really been something to celebrate. That's what's kept us strong and resilient throughout this period, and we anticipate that it will help us to navigate the challenges and the opportunities over the next few months. Thank you. That's the end of my presentation.